Hi, everybody, and welcome back to another video. Today we're going to be talking about, do you have structural acid reflux? What do I mean by that? I mean, is your acid reflux caused by damage to nerves, basically? Um, why am I talking about all this stuff? I'm going to be doing lots more videos. This is just one little aspect of it. There's so much to learn about this stuff, and to show you that there's a missing part of information that we were not taught. And I've studied this from the top neurosurgeons and neurospecialists. I'm self-taught, all because of my butt thorax orthopedic wedge and what I've seen it do, and then taken all this information and applied it in my practice in treatment because I have access to hundreds and hundreds of people every year, and I've been doing this for 2.5 years now, and I know this works. Uh, like even acid reflux, what were you told about it? Avoid foods. You have a sensitivity to foods, or you have a hiatal hernia and somehow the esophageal sphincter is not closing. You're overweight, you smoke, whatever. But there's another reason. It's again the toaster analogy. Modern medicine today is focusing on the toaster, but anybody who knows anything about fixing toasters or machines knows uh, the first rule of troubleshooting for something like a toaster is always check the line cord, and that's what science today doesn't really look at. And I believe that most of the time you don't have 5, 10 different issues like acid reflux, headaches, cold hands and feet, gut problems, anxiety. It's all one problem, and it's all related to especially your spine and especially up here in your neck or lower head brain. Okay, so we're going to start. Do you have structural acid reflux? And I'm going to show you how you can tell if you do or not, because it's instant once you do. And I've done this to a lot of clients, and most of them don't have acid reflux anymore. And some are severe, some are, occasional acid reflux, some are on medications, and I've helped all of them. Maybe not cured it, because I don't cure stuff. I help your body fix itself. But yeah, a lot of people have don't have acid reflux that come see me anymore, or they get it a lot less bad and they know what to do when they do get it. Okay, so let's get started. So how can you tell instantly if you have structural acid reflux or GERD? Did anyone tell you it could be caused by bad nerve signaling from the nerves in your neck? If it is structural, how do you fix it? And what does your doctor or Dr. Google tell you? Okay, so here's something I pulled off on Google. How can I stop my acid reflux? Try to maintain a healthy weight, stop smoking, elevate your head of your bed, avoid foods and drinks. Okay, the usual stuff, right? So here's something else I pulled off. And you almost need to know the answer when you're searching for this stuff because it's like they don't talk about damaged nerves like I do. So suffering from acid reflux causes and symptoms. This is from the Cleveland Clinic. Acid reflux is caused by weakness or relaxation of lower esophageal sphincter, which is the valve that stays closed so the acid reflux doesn't come back up. Okay, so it might not be food sensitivities, right? What happens if the esophageal sphincter is not closing? A ring of muscle fiber in the lower esophagus prevents swallowed food from moving back up, right? There's muscle fiber. These muscle fibers are called the lower esophageal sphincter. When the ring of muscle does not close all the way, stomach contents can leak back into the esophagus. Okay, yes, and that can happen for sure. If you have a big stomach and you're full and you sit down or you lay down, I guess it can force back up. It can cause your sphincter to not work good. Absolutely. But I believe most of the time it's something different. Okay, so how do we know uh, that it's the esophageal sphincter? Um, let us see. Oh, yeah. let's see what innervates that esophageal sphincter. Because we have to look at this stuff. If you don't look at the neurology, you're not getting the whole picture. Every problem that you have can be nerve related, nerve signals not getting through. And when you see what's going on in the neck, it's very easy to understand. So the lower esophageal sphincter is innervated by both parasympathetic vagus and sympathetic primarily phalangic nerves. However, the vagal pathways are the ones that are essential for the reflex relaxation of the lower esophageal sphincter, such as which occurs during transient LES relaxations. So yes, the vagus nerve controls the sphincter. Here's a little bit more about that. As you know, you cannot purposefully control your esophagus, hence it is under the involuntary control of the autonomic nervous system. The parasympathetic component of the cervical part is supplied by the recurrent laryngeal nerve, a branch of the vagus nerve. And there is sympathetic innervation there, but the actual relaxation part, so you can see here in this photo, okay, and it's the right side usually that affects the digestive. So whether it's your food gets stuck in your throat or in your esophagus, it feels like it doesn't go down, acid reflux, then gut problems, it's usually from the right side vagus nerve. Left side would be more heart related and other things. And we'll get into that another time. Okay, so now we know that acid reflux can be caused because lower esophageal sphincter may not be closing properly. That makes sense. I'll say according to Dr. Ross Hauser from Caring Medical, who I've studied from so much. He has the best videos out there. You got to listen to him. Dr. Ross Hauser on YouTube, he's put out videos about all this stuff, and he knows because he has the proper scanning systems, and he does prolotherapy, which I think would probably be amazing to have everywhere. Every doctor's office should have one, but unfortunately, he's like one in very little. Okay, so if you want to learn about the vagus nerve, Dr. Ross Hauser does 3 2-hour podcasts on it, and you will understand. Okay, so all sphincters are controlled by the vagus nerve, all sphincters, even in the ears and throughout all your guts, and also has sympathetic control. Okay, so look at the vagus nerve, comes out of your brain. So basically right behind your ear, there's C1. You have a little pocket behind your ear, C1, and then it goes down right in front of C1, and the brains of this nerve are in front of C2, so the ganglion. I believe it's those ganglions. So if your neck is not proper, you don't have a nice C curve, you're looking down all the time, you're turning your neck a certain way, you can actually irritate this nerve, and that's how I fix it. And I'll show you soon. Or fix it, I help somebody fix it. Vagus nerve is a cranial nerve that controls your rest and digest parasympathetics, and it comes out of your skull in front of C1. And C1 has a little hook in front of it too. And I believe most people have instability in the C1, C2 region. C1 has a little hook at the end of it, and if you have poor posture or cervical instability in between your joints, too much movement, if you're hypermobile, you are more likely to have something like this. You have a good chance of irritating, damaging the vagus nerve anytime you turn your head or look down. In my practice, I would say that acid reflux is one of the most common nerve problems I see. How do I know it's a nerve problem? Because that person also usually has upper back and neck pain and often headaches. Then I perform my test for structural acid reflux, which is a growing part of many tests that I've come up with to test for your symptoms having a structural cause. And I have a lot of cockamamie kind of things, but they're not. And I show you, and when I show the patient, when all of a sudden something changes, they understand. Because again, this knowledge is not out there. So that's why I'm out here. I'm showing you this stuff because it's very important. Your health, you shouldn't be so scared of it. You should really watch your posture, and a lot of things can get better. Yes, exercise and eating right is very important as well. But this is the missing piece of the puzzle. So let's get going with the test. So test for acid reflux having a structural cause can be performed seated, standing, or laying down supine. Vagus nerve exits the skull on both left and right of the upper neck. For this test, we'll be working only on the right side of the upper neck, best to test. So if the person's not experiencing acid reflux at the moment, then they can't really tell. I mean, you can still do it, but you won't be able to tell. So if you have acid reflux, whether you're a practitioner or you have it yourself, you can do this. Place index finger behind the right ear and find a little pocket behind the lobe. There's a little hole there, a little pocket. Palpate and moving posteriorly, gliding your finger with slight pressure, and like strip around that bony bump called the mastoid process. Do it a couple times and you'll notice immediately. If it is structural, you'll notice immediately. You'll notice symptoms. For most people, it depends how much damage is there, but for most, it'll help. And I give this exercise to all my clients afterwards, and they love it. So it may also, when you do this a few times, you might start hearing stomach sounds, or you might have to go to the washroom, or something can happen because this is your digestive part of your vagus nerve. If nothing happens or other symptoms appear, if it's starting to give you a headache or something, stop doing the test. You really got to learn your body here and figure it out. But it's really not that hard. Now, this is a test. It can also fix the problem temporarily or longer. To fix the problem completely would be to address the neck and your curve and strengthen upper back and neck. Do some form of exercise. I can't give one exercise for all people because nobody's the same. So you got to figure it out for yourself. I do post a lot of stuff on Telegram, different exercise routines and things like that, things that you can stimulate the vagus nerve. But if you're not stopping the damage, so yeah, you can do the little pressure points here and there, but if you're not stopping the actual physical damage in your neck, you're not going to fix it. So this is a temporary fix, or for some, it could be the fix. But for most people, it's to correct whatever you're doing that's causing the bad cervical structure. So a lot of strengthening back there, and looking down is very bad. I know I say it all the time, but I'm not saying it for no reason. Okay, so strengthening exercise, and turn your head sometimes and see which movements are good and which ones aren't. You'll notice. So avoid the ones that aren't good. Continue to strengthen, and you'll see. It's really not that hard. So thank you for watching. Please like and subscribe to my channel. I know I hate it when people say that, but seriously, I know you know people that have this, and this is just the beginning. So I'm trying to help people, and nobody's putting it out there like me, because most massage therapists or physios, whatever, don't really study what I've studied. And I only came across it because of butt thotics, and I needed to know why the hell somebody's headache is going away. And I got some good news coming. I have a meeting with one of the top neurosurgeons that I've studied from that actually wants to hear what I have to say in June. So we'll be talking about that down the road. I can't wait. Finally, I get to talk to somebody who knows about this stuff, because again, most doctors don't. So there's a lot about our bodies we don't know. Feeling great and healthy isn't as complicated as we think. I'm telling you, it ain't. So stay tuned for more. Level your hips, change your life. That's always my saying. Because if the hips are level, the foundation's level, the roof will be better level, especially if you're sitting a lot. Now, again, it doesn't work for everybody. So be careful when you use it. Be aware of your body. You are responsible for yourself. Okay? And go to buttthotics.com to purchase. For content, for more content, join Telegram at but_thotics_learn. That's at Telegram. And of course, you're here on YouTube. All right, so thank you very much, and we'll talk to you soon. Next video, we're going to talk a little bit about headaches. Okay, thank you very much.